Hello, my name is Dr. John Webster, and I'm glad you're joining me this time. I'm going to talk to you for about 30 minutes. Now, if you're one of my newer patients, then I've asked you to watch this video because to me, this is what chiropractic is, the experience I've had with chiropractic in my 36 years of practice. So if you just found me on YouTube and you're doing a search about chiropractic, you may find it interesting too. But I'm going to use this chart, and I want to apologize for a little bit of glare that I see. And then when I turn the page, it's going to make a little crackling noise. So I apologize in the beginning for that. But I hope you'll give me your attention, because what I'm going to share with you is, like I said, 18,000 patients, 36 years of practice. And of course, I work with medical doctors and physical therapists. But I've just seen so many things. And I want to start off my talk by saying that you live your life through your nervous system. I just want you to understand that everything you see, hear, feel, taste, and smell, you take it in through your nervous system. If you're too hot, you sweat. You're too cold, you shiver. If you get mad, angry, upset, or afraid, your body goes into a fight, run, hide, crisis. And so all of this is coordinated through the nervous system. So if there's interference or stress on your nervous system, it can cause your body to communicate improperly. And so I'm going to go into the details, and I'll try not to bore you. But the talk, of course, is chiropractic health for life. And so again, I apologize for the chart making this noise. There we go. Okay, so now my name is Dr. Webster. Now my education or my degree is that of a DC. That stands for Doctor of Chiropractic. Just so you know, chiropractors go to school almost as long, sometimes longer, depending upon the specialties that we want to acquire. But it's you have 4 years bachelor's degree, and then another 4 years of chiropractic degree, and then there's an internship where we're supervised, and so it's a very detailed process. And I currently serve as an examiner for the National Board of Chiropractic Examiners, and I can tell you, I would put this examination against any other profession. And so when a new doctor graduates, they are tested very specifically, very scientifically by people like me. Everything is just amazing. The test is incredible. So in today's healthcare world, I can tell you as a national examiner for the chiropractic board, if they're not competent, they don't pass. And I'll just say it like that. So only the good ones, only the competent ones. So let's move on and talk about more things now. So why do people see a chiropractor? Most people have come in because they've had back pain or headaches, maybe a car accident, maybe on-the-job injury. So different people go to chiropractors for different things. Now there's also people that come in, and once they find out that, hey, this feels good, I like it, I don't want my problem to come back, they come in for prevention. And then I have had patients walk into the practice and say, hey, you know what, I've been reading up on chiropractic, I already exercise and eat right, and I do yoga, whatever else they may say, and they say to me, I want to add chiropractic to my lifestyle. So chiropractic, 20, 30, 40 years ago was still not known very well, and sometimes talked negatively, and I'm not going to hide the fact that there are some chiropractors out there that don't do things right, just like there are in other professions. So as a rule, I speak for the vast majority of chiropractors. We're well educated, well qualified, and we understand the nervous system and your spinal column like no other doctor does. Our education is unique. We focus on the spine, the nervous system. We're excellent when it comes to diagnosis, neurology, reading x-rays. There's so many things that we do better than the traditional medical doctors. And of course, there's so many things the medical doctors do better than us. So every healthcare provider has their place. No one person has all the answers. And that's why I enjoy working with a network of medical doctors. And if you come in to see me and you have a problem that's outside of my scope, I'm going to refer you out to somebody I know and trust. So anyway, let's keep going back to this. So people come in for different reasons. So let's turn the chart. Okay, so let's start with some definitions. I hope you can see this okay. But Dorland's Medical Dictionary is a dictionary that's used in medical school by pretty much everybody. And so we're going to look to that dictionary to see what health is. So, and I'll try to read it. Dorland says that true health is a state of optimal, that means the very best, physical, mental, and social well-being, and not merely the absence of disease and infirmity. So I'm sorry, but the way our society is, we have taken on the notion that if I feel good, I must be okay, but if I feel bad, I'm sick. And I just want to speak to that. I know personally people that have dropped dead of heart attacks. I know personally people that seem to have have good health and be doing fine and find out they have cancer and in 6 weeks, 5 weeks, they're dead. So you cannot go by how you feel. Matter of fact, the American Heart Association tells us that a good number of people have no symptoms before they have a heart attack. So if you're bought into that mindset, if you feel good, you're healthy, please don't fool yourself. You need to get checked. You need to, blood pressure and all these other things can sneak up on you. So don't go by just your feelings. Number 2, Webster's dictionary says that health is a condition of wholeness in which all your organs are functioning 100% all the time. And of course, that's my favorite, right? All your organs are functioning at 100% all the time. Okay, let's pause right here. What runs the organs? What tells my eyes when to blink, my heart when to beat, my stomach how much acid it needs to digest food? Who's in charge? Well, your brain's in charge. Your brain is like this master computer. It connects to every cell in your body, and it tells that cell what to do, how to do it, how often, and then that cell responds back to the brain, well, I'm doing this or I'm not doing this, and that's how your body health. Everything is either directly or indirectly affected by the nervous system. And that's what Grey's Anatomy says. Now, Grey's Anatomy is not the TV show. For those older, and we know that the Grey family was a family of medical doctors back in England, and they used to do autopsies by the thousands. This is the early days of medicine. And so they have written numerous books, and I have some of the books. And those books, in other words, say that the purpose of the brain and the nerve system is to control and coordinate the function of all the tissues, organs, and systems in the body, and it adapts the body to the environment. I mentioned before, if you're too cold, you shiver. That's the nervous system causing an increase of blood flow in your body, which helps you to warm up. If you're hot, you sweat. If it's hot summertime outside and you're working hard in the yard and you start to overheat, your nervous system knows that, and so it causes you to sweat. You don't have to think about it. That's why it's called the autonomic nervous system. And then I mentioned again, if we get mad, angry, upset, or afraid, our body goes into a fight or flight. But your nervous system is always taking care of you. When you put food in your mouth, your nervous system communicates with what kind of food, how much it is, and then your organs respond by your stomach secreting acid, how much does it need, and not too much, not enough, et cetera, et cetera. And your pancreas, if you eat sugar, your pancreas has to communicate, how much insulin you need in the bloodstream. And if you eat a diet that has a lot of fat in it, then your gallbladder, your bile duct has to be able to dump some bile in there to help break down the fat. So there's always communication between the cells of your body, with each other, and with the brain, the master control center. So now there's a condition that in chiropractic is called the vertebral subluxation complex. You may have heard the word subluxation or not, but simply put, it is where your spine, some vertebrae in your spine have somehow gotten out of alignment. You could have had a fall, an accident, an injury. It could have been, an average child falls 1,000 times, they say, before they're 12 years old. And so maybe you flipped off the bicycle, tricycle, playground equipment, it depends on how active you were. You could have been a child who likes to climb on things, would fall off furniture. But numerous falls happen before the child is even 12 years old, where your spine is growing. And if you have a significant fall and it's not, realigned or checked, then it's logical that the spine may grow improperly. And all of this has been studied, and I can provide studies if you want to see them. So that's what we look for. Then if you played sports, or if you had poor sleeping posture, or anything like that, if you had any kind of traumas to yourself early in life, I can tell you from experience, your brain may forget, but your body doesn't, because I've had a lot of injuries in my past. But we look for misalignments. We look for spacing in between the bones. You're supposed to have enough spacing so that the nerves don't have any pressure on them, because your nerves carry these impulses. And inside these vertebrae spaces, the nerves have very little to no protection. They're very sensitive. So the slightest bit of tension or pressure in that vertebrae can cause an interference with that nerve process. Now, a drastic example of this would be a motorcyclist or somebody who actually gets their spine twisted so hard that it may sever a nerve, or like Superman. And for those of us that remember Christopher Reeves, he was riding his horse, he jumped, he fell, he broke this first vertebrae, and his lungs shut down. So you live your life through your nervous system. So my job as your chiropractor is to focus on the spine, because the spine and the nervous system are intimately connected. And if your spine is damaged, it's like a short circuit. By the way, I used to be an electrician. I was an electrician when I got out of high school, and I was an electrician as I worked my way through college, through chiropractic school. So now I'm a human electrician, if you will. My focus is on the spine, on the nervous system, now, alignment, spacing, and movement, because that affects your nerve supply. Okay, let's keep going. So that's what I do as a chiropractor. Okay, so let's go back to the beginning. This is the picture of different stages in the birth process. I'm just going to review this again to show you how marvelous the body is. The first organ to develop in your body is called the primitive nodule after fertilization, So the egg and the sperm meet, and then we start having cell replication, formation. And the first organ that's visible under a microscope is the brain. The brain takes over the development of all the rest of the body. And so you can see after 4 weeks, you can see the heart shadows and some arteries forming. 5 weeks, you can see an eyeball is forming. I know you can't see this very well, but 6 weeks, there's the back of the spine growing. I'm going to circle around over here to 11 weeks. At this point, you can see the placenta, the yolk sac, and the baby. And so 11 weeks, you are the size of your little finger, and you weigh 2 ounces. But all the cells are just, everything's in place due to the wisdom of the brain, from the egg and the sperm, your genetics and all that stuff. Okay, we go down a bit further, and this is 18 weeks, and I hope you can see this. This child at 18 weeks, she or he are still inside the mother's womb, and it's sucking its thumb. Now, this is the key part here. Why would that child be sucking its thumb? Well, we know that the body has some kind of intelligence. So whatever you choose to call it, soul, spirit, innate, chi, different religions have different names for it. I guess our Native American friends would call it the Great Spirit. Whatever you choose to call it, there is an intelligence in this body like there is in every living thing, whatever you choose to call it. So that intelligence, whatever it is always going to do what's best for the human body. Like I said, if you're too cold, you shiver, too hot, you sweat. If you're in danger, you run. That's that wisdom we're talking about. Well, that wisdom is teaching this child to learn how to suck. It's a suckling reflex. So the wisdom in this child through the brain and the nervous system has caused that child to put his thumb in his mouth, and he's sucking his thumb. So that when he is born and he gets on the outside, he can suck his mother's breast or a baby bottle. Now, I know that may be news to you, or you may say, oh, I know that. But to me, that's just a clear example of how the body is always looking out for itself. It heals itself when it's sick. It maintains the health. It does everything it can to keep us healthy. And all this information is in that nervous system. And that's why we focused on that. Okay, so let's keep going. So the brain, we talked about the brain is the major generator. So there's different parts to it, and you can see the color there. So I'm just going to go through them. Your basic drives, your appetite, there it is, tissue, organ, and system function. So it controls all that. Your coordination, your fine muscle movement, and everything. Your orientation, your mood, your behavior, everything about you is affected by your brain. Like I said before, you take in information from the environment. It could be your wife or husband or child or boss, and you process what you heard, what you felt, and then you come up with an answer on how you're going to respond. All of that's through your nervous system. So if you notice that you don't feel like you're processing maybe or responding the way you should, maybe something feels off, who knows? It could be something not right in your nervous system. Just something to think about. Okay, so the nerve system at the very bottom, so this is the major connection. Your brain goes into the back of your skull through the bottom there. Then it becomes a spinal cord, and your spinal cord runs down through your spine. And then in between each vertebra, nerves branch off. And that's what carries the information. It carries energy and information to every cell in your body to tell it what to do. All right, I'm going to flip again. I apologize. All right, so we focused on the spine. Again, this is your head. Of course, you're facing this way. You're supposed to have a forward curve in your neck. You're supposed to have a little bit of curve in your shoulder blades, not too much. And you're supposed to have a curve in your back. Now, let me explain those. All of us have seen enough TV. When the baby is inside the mother's womb, he's all balled up. After the child is born, he's laying on his stomach, and he begins to raise his head. That's when this curve is formed. You're supposed to have that curve throughout your life. And then whenever the little baby, boy or girl, gets up on his hand or her hands and knees and starts to maybe crawl, the belly drops down, and that's when this curve is formed. And they have different names, lordosis, kyphosis. But when you stand up, your ear should be over your shoulder, over your pelvis. So that means you have like some flexibility. Like the average head weighs 8 to 12 pounds. Mine's probably 12 or 14. So every time you take a step, it's got that flexibility. Same thing for your lower back. Every time you take a step, flexibility. Scientific doctors, medical doctors, orthopedic surgeons, neurosurgeons, everybody agrees. And again, I have the articles. Everybody agrees when you have the proper amount of curves in your spine, there's less stress on your nervous system. There's more energy for your body. You have more stamina, and you're just healthier. So all the doctors agree that you need to have these proper curves. Anybody that says poor posture doesn't affect your health, they're just wrong. They're just wrong. There's so many studies showing that poor posture has a negative effect on your heart, your breathing, your digestion. So even now more than ever, I am stressing good posture in the practice. So good posture, and I'm gonna turn sideways. Good posture is when the ear is over the shoulder, over the hips, over the ankle. So you need to have good posture. We'll talk about that more. So that shows the spine, and we'll go over that more when you're in the office. So, okay, so back to this condition we talked about. And again, we can call it a big fancy name like subluxation, or we can just call it misalignment. It doesn't matter to me. The whole point is your spine needs to be in proper alignment. There needs to be space in between the vertebrae. There needs to be enough room for the nerves to be able to carry impulses with no stress. Well, most people have had some kind of fall or accident or injury. All of us have. And so the spinal joints, they do get sprained. Like you sprain your ankle, the same thing can happen to a spinal joint. And you know how your ankle swells up. You don't see that in your spine because it's deep inside the body. But when that spinal joint, now I'm going to use the vertebrae here. When that spinal joint gets sprained, like this is the back of you here, and these are the nerves. So if that joint gets sprained enough and it twists, it's going to compress against the nerve. And I know that's so simple, but I can tell you after all these years, misalignments in the spine can and will put pressure on the nerve, and that will lead to numbness, tingling, sometimes muscle spasms. But let's just go over the chart. And I have medical reports here that I can refer to, but different doctors have talked about how the joints get injured. Now, sometimes the joint will get twisted and it will get stuck in the wrong place. And I've seen that when we take x-rays. Sometimes the joint will get injured and people will notice extra popping. You know, it does this every time I move. That means the joint has become hypermobile. And then some joints just simply get misaligned. But anyway, when this happens, it can affect the nervous system. Some people have pinched nerves, and you probably know somebody that has numbness or tingling, or maybe, I have patients who waited too long to come see me and they started to lose strength in their hands, and you could even see some of the muscle, withering. So you don't want that because, again, you live your life through your nervous system. Secondly, the muscles, as I said before, are affected by the nerves. If you're prone to have muscle spasms, most likely it's because one of the nerves is irritated. An irritated nerve causes too much or hyperactivity of impulses, and that can cause muscles and organs to over-respond. So that can happen. Again, that's by Dr. Cocaldi Willis. I have Dr. Alf Bragg. I have Dr. Jan Uraut. I have all these reports here we can share with you. So then you get inflammation. We talked about this before, that if your ankle is sprained, you see that it's swollen because there's not much fatty tissue and muscle around the ankle. So if that happens in your neck or your back due to a fall in the yard or garden or car accident or on-the-job injury, if it stays that way long enough, it's going to lead to what we call widespread scar tissue. And again, I've dissected human cadavers and I've read enough books and looked at enough MRIs. Scar tissue around the spine is quite prevalent. It's there quite frequently because the vertebra, once they rotate, the blood flow can't get in and can't get out, and the pool and blood kind of pools around that area, and left to itself, not corrected, it will lead to scar tissue formation. And I've talked to enough surgeons to know that's true. Okay, so first of all, the joints do get out of alignment. We all have falls, accidents, injuries, stress, hard work, poor posture, bad sleeping habits, falls down the stairs, in the backyard, falling here or there. We've all had those things happen, and that can cause nerve damage. It can also cause muscle spasms, inflammation, swelling. So this is a side view of the neck. And again, I hope you can see this, but I talked about the baby, how the baby holds his head up and that curve forms. So you want to have that curve that gives you strength, stability, and flexibility. But this is when you've lost that curve. And I'm seeing this more and more, especially in young people with smartphones and more adults who are working from home. And instead of a desktop, they're using a laptop and they're leaning into it like this. So I'm seeing more and more necks that have lost the natural alignment and movement, and that's a problem. That's a danger problem. So once you lose that alignment, if you don't get it back and take care of it, it's just a matter of time before that joint begins to decay. This, you can call this spinal arthritis, you can call it osteoarthritis, but if the vertebrae lose their normal alignment and movement, they are more prone, especially after an insult or trauma, they're more prone to develop arthritis. And so that's what we see here. And if it's not corrected as time goes by, it usually gets worse. People tend to get shorter as they get older, and they get slower and stiffer and weaker, and then they get sicker. Well, that's secondary to the spine. I've got two examples here. So back to this model. So this is the nerve. This is the nerve that maybe supplies some part of your body. Let's just say anything. That's the disc space. You want that disc nice and thick, and you want the bones lined up good. So early in life, the discs are nice and thick, healthy, and the nerve has plenty of power, plenty of room, strong impulses, okay? I'm gonna fast forward to somebody who's very elderly and they've lost a lot of their height, and so now they look like this. See the disc space, this is all spur formation. This is commonly known as osteoarthritis, wear and tear. And then look how frail the nerve is. See the nerve, the hole where the nerve comes out has closed up. And as I mentioned to you earlier, inside this hole, there's not a lot of protective covering, and any tension or stress on this nerve in this space can lead to nerve interference or nerve damage. And so this would be somebody who's bent over, they're obviously short, they're probably taking a lot of medicine, they're probably not happy, not healthy. So you never want to get to this, never. So that's why, chiropractors want to help people as much as we can. Okay, so there's different stages, and that affects how your body functions. And I hope that makes sense. Chiropractic is really simple once you understand the basic fundamentals of the human body and how it's put together and how it works. Okay, so I'm gonna flip this page again. So some of the causes, how does the spine get out of alignment? And we've already talked about some of this. I have birth process here, and I'm not here to criticize anybody, but I've lived long enough and taken care of enough patients that sometimes the birth process, and I'm not here to criticize anybody, I'm not. But sometimes the birth process, you're in a hurry, and the pulling and the twisting, and I could tell you things that I've witnessed, but we won't even go there. But if you have recently had a child, or know of somebody who's had a child and the child doesn't seem to be developing quite properly, or you're just curious, you could bring that child to a good chiropractor, and we would very, very carefully just do some palpation. We're not going to do any popping and cracking and x-rays. We're just going to check to see if anything feels like it may have gotten pulled out of alignment. And again, that's not a negative. It's just something to think about, because the birth process can be quite traumatic for mama and the baby. And then there's all kinds of pollution, occupational stress. I talked about that before, where you're sitting in front of your computer for hours and hours and hours. And those of you that are home, please discipline yourself and make yourself, do stretches. Like in the office, we give people exercises to do on a regular basis, because my goal is to get you in proper spinal alignment that will take the most stress off your nervous system, and that'll give you the best chance to express your best person, whoever you are. Okay, occupation, medicine, drugs, I don't have to tell you. Eli Lilly was a former CEO of a pharmaceutical company, and he said any drug without a side effect is not a drug. And so, I don't have to tell you, this country, we are like 5% of the world population. We take over 50% of the drugs. Last time I read some research, we take like 80% of the narcotics. It's just terrible how much medicine, and I'm not saying medicine is bad. If John Webster needs medicine, I'm going to get some, because I've got logic, I've got common sense. But a lot of people pop a pill for this and a pill for that and a pill for this, and it's just too much. And drugs are toxic, and I'll just leave it at that. And I'm not saying quit your medicine. You do whatever your medical doctor tells you to. You do whatever your medical doctor tells you to. But if you want a second opinion, of course, I'm here to look at it from my viewpoint. But anyway. Okay, then there's mental stress, environmental stress, the kind of work that different people do, and then psychological stress, that's everywhere. Everybody's stressed out. And I want to pause here for a second. There's a whole field of medicine that I love. It's called epigenetics, and it has a lot to do with how we think. For years, authorities, medical doctors have told us that our genetics are so powerful, and our genetics will determine, like if your mom and dad had this disease, then you're going to have it. Well, I'm here to tell you, the field of epigenetics, with good quality medical doctors in it, they're saying no. We're not, your genetics do not play the major role. It's your thoughts and it's what you do to your body and for your body that can override your genetics. And so if you have any interest in that, I'd love to talk to you about it. I love epigenetics because there's a lot of diseases that run in my family on both sides. And at this point in my life, I should have already had some of that stuff and I haven't. And I think a lot of it, well, I give God the most of the credit, but of course I get adjusted. But also epigenetics. I do a lot of things that my family does not do, and the research tells me that that's helping me not to have these diseases. So if you have any interest, we can talk about that. Okay, and then the physical, everybody's had falls and accidents, sports, oh my goodness, car accidents. I'm an expert witness. I take care of a lot of car accidents. If you or somebody you love has been in a wreck, I'd be happy to take care of them. And again, I have medical doctors that work with me on these conditions. Sports, housework, and then if you have any kind of old injury that you didn't know you had, and then you have a new injury on top of that one, it just complicates it further, excuse me. Okay, let me flip this over. Okay, so these misalignments, if you will, can cause all kinds of problems, and there's a whole list there. But again, your brain supplies information and energy to every part of your body. And if you have a condition in your spine where the nerve is under pressure, you may not be getting all the energy and information you need to that body part from the brain. I hope that makes sense on a logical level. Absolutely. Okay, so let's keep going here. So let's say that you get everything corrected. So you get your spinal, your vertebrae back in line, so the nervous system now has no stress on it. But that means you're going to have better function, better health, probably better energy. And then your muscles are going to be, not tight and spasm like they were, but more relaxed. And then your ligaments and your disc, your posture is going to improve. The way you carry yourself is going to improve. Now let's say that when you took x-rays with me, you were a certain level of arthritis already. There is studies show that certain exercises and of course hydration and adjustments can help to slow down that degeneration process. I mean, it just makes sense. If you keep opening this joint, if you keep opening it and taking pressure off that nerve on a regular basis, then that will help you not to get worse, at least not as fast as you were going to. So chiropractic does relieve pain and also help you to enjoy life more. Matter of fact, I have 3 goals for every single patient. Number 1, I want you to feel better. That's my main goal right there when you first come in, because I know you're in pain. Maybe you've been to other doctors, maybe you've not gotten results. I want you to feel better. And I want to see that happen in the first 2 or 3 visits if possible. Number 2, though, I want you to be healthier. I want you to tell me after you've been coming for a while, you know what, Dr. Webster, I didn't make a connection, but when I first started seeing you, I couldn't do this or this or this or this. But now I've noticed that I can do that again. This is the truth. I had a lady in the office the other day. She had been coming for a while, and she walked into the adjustment room and she says, "I want to show you something." And so I said, "Show me." So she sat down on the floor, Indian style, with her legs. You know how you cross your legs, and then and she comes up off the floor, not using her hands. She comes from sitting on the floor, Indian position, cross leg, and stands right up. And of course, I'm amazed because I can't do that. And she says, "You know what? I used to be able to do that. And years ago, I got to where I couldn't, and I thought I'd never get it back. But because of you, Dr. Webster, because of coming here, I can do it again." So we hear that kind of stuff all the time. So I want you to feel better. I want you to be healthier. And then if you're healthier, you're going to enjoy life more. You're going to be able to do the things you used to do the things you like to do with your family, friends, whether it's golf or gardening, whatever you want to do, you're going to have more fun. So I hope that you'll get those results. Okay, so as your nervous system improves, so your spine improves, and again, I'm just kind of repeating, all your organs improve, your attitude. If you feel better, you're going to have a better attitude. A lot of people don't have a good attitude because they feel bad, and I get that. But once you start getting that health back and you can see the difference, you're going to feel better. And I've noticed in myself and other patients that if you do, you have more resistance. Now, and if you do get sick with a cold or flu or whatever, your body tends to bounce back better, because you just can't deny the nervous system affects every part of your body, and that includes the immune system. So the better you take care of yourself, and of course, it's not just chiropractic, it's eating right, it's resting, it's exercise, it's nutrition. But that nervous system runs everything. So you want that nervous system to be 100%. Okay, so let's keep going. So now, when you come into the office, you'll probably hear me say this, or if you're one of these patients that are looking to try to figure out if they want to try chiropractic or not, chiropractors, you will find, have different philosophies, if you will. So in my office, I offer my patients 3 different levels of care. Number 1 is pain relief. If you just want to come in until the pain goes away and then you want to just stop coming in, that's okay with me. I mean, it's a free country and it's your body. I'm going to encourage you to maybe not do that, because it's like if you don't get enough adjustments or realignments, if you will, to get that vertebra in a better, more stable place, then if you drop out, the chances are likely that that vertebrae is going to work itself back to where it was, and the problem could come back. And if it comes back again, it could be worse. So I hope you don't stop with just pain relief. I hope you continue with what we call the corrective thing. Now, what is that? That's like putting braces on crooked teeth. You come in with the pain or the problem or the symptom, whatever it might be. So in a few weeks, we got you out of pain. So we do an exam, and that exam will show me if your condition is stable enough for you to be let go. And if the exam is clean, if there's no positive test and you feel great, then yes, we'll release you. But if the test shows that there's still some things that are not quite right and you're not ready to be discharged yet, then I'm going to encourage you, well, let's give it a little more time. And of course, I'll reduce your visits, and whenever we feel like you've stabilized, then we can release you. And then there's some people who come for wellness care. Personally, I have been getting adjusted since I was 22, and that's been a long time. I personally currently get adjusted on a weekly basis. And again, I searched the research because I have a certain level of injuries in my spine. I have a certain level of degeneration. So I went through the research, the medical research, and I found studies that indicated to me that once you have degeneration in your spine, once your spine has been damaged to a point where you have these spurs, if you let it go to itself for a certain number of days, you can see under a microscope that it gets worse. So I could imagine, if I neglect my spine, then I'm going to be like everybody else. As I get older, I'm going to get shorter, stiffer, weaker, sicker. And I said, no, I'm not letting it happen to me. So I found enough research to show me that if you get adjusted on a regular enough basis and you keep those joints open, then you slow down the process of them closing up. So I'm a wellness patient. I get adjusted once a week, and that feels good to me. That keeps me inside of that certain time period that I found in the medical literature. But whatever you want to do is good for you. And there's patients who come in and they'll come for a while, feel better, and disappear. And then they'll come back later and they'll say, well, you were right, doctor. And we'll pick it up where we left off and try to get you out of pain. And most people, once they've had 2 or 3 episodes of pain, then they say, you know what? I got to do prevention. I got to do wellness. I got to take better care of myself. And to me, that's a very intelligent decision. You only got one spine. You only got one set of nervous system. There's all kinds of surgery now that can replace all kinds of organs, but you gotta take care of the spine and the nervous system. That's my whole point. Now, there are different types of patients. Now, I take insurance. I'm in most insurance networks. I'm not in all of them and I won't go into the details, but some of them are just impossible to be in, and it's humiliating and it's so inconvenient for the patient. But I'm in most major insurance companies. And like I said before, I do a lot of personal injury. If you know of anybody who's been involved in a car accident, I think I'm one of the better qualified chiropractors. And then we have the wellness patient. So whatever type of care you want to come in, we're here for you. Okay? We're almost done. Thank you for hanging in there. So responsibilities. Hopefully I've shared with you some information that you didn't know about. And there's so much more that I could share, but I'm trying to keep this thing in a certain time frame. So if you know of anybody that maybe I could help, or maybe a good chiropractor could help. Maybe, let's say you don't live in this area. If you know of anybody that maybe is suffering, they've gone to different doctors, nobody's helping, but they're not going to a chiropractor, encourage them to try a chiropractor, because more and more people are doing it. Harvard Medical School back in the 90s did a study that showed more and more people are spending their time and their money on alternative health care, which chiropractic used to be considered. Now we're more mainstream. We're accepted by Medicaid and most all insurance companies. So anyway, if you know of somebody that's suffering, tell them about it. My responsibility, if you're coming to me, I can guarantee you that I will be here for you, and I will be somebody you can depend on. I'll do my part. And if you have anybody, like if you belong to a civic club, or you have a mother or friend in an assisted living or independent living, and you need a speaker, I give speeches and lectures outside of the office as much as my schedule will let, and of course I love it. You can tell I like to talk about chiropractic, but there's all kinds of ergonomic things that we can talk about. Your job is to keep your appointments. I really want you to do that. And if you have any family members that are suffering, I'd like to see them. I mean, in my practice years, I've had 4-generation families come in, and everybody gets adjusted. So it can be a family thing for sure. I have a lot of couples that come in, and if you have somebody that they don't know what to think about chiropractic, they're kind of on the fence, have them watch this video. Just send this to them and say, hey, this is the chiropractor. He's been in the game a long time. Watch it and see what you think. If they have questions, I'll make sure I have a contact number or something down below you can call. Okay, so we're almost done. So what is the adjustment? The adjustment is when I have had an exam, I've taken x-rays, I know which vertebrae in your spine is twisted or jammed, and I know how far and which direction. So an adjustment is a very specific movement in the spine to correct misalignment, to open up the spaces, to relieve pressure on the nerve. So the adjustment is specific. It is not popping bones and cracking backs, as somebody might say. No, it's not. An adjustment is very simple. Or not simple, but specific. Let me say that. Okay, do they feel good? Okay, so if you've ever had a splinter in your foot that got up in there and it was bothering you like crazy, and finally you had to sit down and dig it out, was it painful to get it out? Yes. So the first time you get adjusted, let's say like the previous page, you've had pain for a long time. The nerves are probably irritated or even tortured. The muscles are in spasm. There's blood flow problems, swelling, inflammation. So you're already in pain. So I will be as gentle as I possibly can. But just that first time, there might be a second where it hurts, and then it's going to feel better. You just have to trust me on this. I'm very thankful. I've never had a negative outcome in my practice. And so the very first time, it's a little uncomfortable, but it only lasts a second, and then you get some relief. So don't let that prevent you. And that's why we do therapy in the practice. We use ice pack, we use moist heat, we use low volt muscle stimulation. We have all kinds of therapies to get you nice and relaxed so the adjustment can be gentle, very, very gentle. And if you have any kind of fear of having that noise, then I have an activator instrument, and we don't have to do the hands. We can do something else. And I use the activator instrument for my senior citizens or for little children. So I will never take you out of your comfort zone. I will always explain what I'm going to do before I do it and get your permission. Okay, so the manipulation and adjustment, those two words are interchangeable, but a manipulation would be like if you walk up behind somebody and you grab them and you pop their back, or somebody doing this stuff, that's a manipulation. An adjustment is specific, where I have the evidence and I have the information and I know what I'm trying to do with your spine. That's an adjustment. All right. Frequency, why do you have to come so much? The clinical research shows that if you have a chronic long-term problem, it's not going to get well with 1 or 2 visits. I'm a good chiropractor, but I'm not that good. So we're going to put you on a program of care. We're going to sit down and talk about it, and you will give me your permission, and I will show you the data, and then we're going to put you on a program of care. So in the beginning, you have to come frequently, but as soon as the severeness of your symptoms reduces and you start to get that relief, we space those visits out, and then we always do re-exam, just so you know. It's not going to be a forever ever thing unless you choose for it to be, and you want to do wellness and prevention. Okay? Do we treat injuries? Yes. There's nobody that needs a chiropractor more than somebody who's been traumatized. I've got research articles. I've got textbooks. I can show you study after study. This is one of my favorite books right here. Anatomical radiographic studies of the spine by Lee Hadley, medical doctor. And in one of his case histories, it talks about a lady who was involved in a car accident. She was 48 years old. And so she went to her primary care doctor, and again, this is not a judgment call, but that primary care doctor was rather closed-minded and said, oh, you just have arthritis, let me write you a prescription. And so she took medicine as he directed, took another x-ray of her 5 years later, and there was significant degeneration and spur formation in her spine that she did not have before. And another follow-up x-ray was taken years later. And so there's a case study in a medical doctor radiographic book showing me what trauma does to the spine and how that spine gets worse with no treatment. So for me, there's nobody that needs chiropractic more than somebody who's been trying that. As soon as possible, you want to get to a chiropractor, get an exam, get those X-rays made. You want to see those X-rays. You want that chiropractor to identify which vertebra are damaged or twisted or sprained, and how you can get those back in better alignment. You want a chiropractor that's going to give you exercises to do between visits. He or she are going to give you all kinds of good advice so that you can get the best results possible. The doctor-patient relationship is not like it used to be. It's not like I'm up here and you're down here. It's like we're on the same team. I'm going to do the best I can with you when you come into the practice. Every visit, you'll get my best. But between visits, I want you to work with me to help yourself so that at the end of it, when it's time to release you, you are happy. You're healthy, you feel great. That's my goal. Okay, so going back to this, the noise. Okay, this is great. You can go on YouTube and search knuckle popping, and you'll see somebody has taken tomography, a special kind of X-ray, and when they pop their knuckle, you'll see the gas go psh. So a synovial fluid is inside the bursa of the little knuckle, we call it. And when you create a vacuum, when you open a joint, it creates a vacuum, and a gas makes that noise. And so when you hear that noise in your neck or back, it's totally safe. There's nothing to worry about. It happens frequently. So that's what it is. It's just a noise. It's called a capitation of a gaseous joint. So that's what that is. Can you have adjustments if you've had surgery? I have helped a lot of people who've had surgery, and I've seen every kind, not every kind, but most every kind of surgery you can imagine. But back in years ago, they used wire and bolts and plates and everything. And of course, today it's more modern, more scientific. And I'm really impressed by what they can do. But my point is, yes, if you've had surgery and you're still hurting, come anyway. I will always do a good exam. I will always look at whatever X-rays or MRIs or CTs you have. And if I feel like I can help you, I'll tell you so. And if I don't think I can help you, I'll tell you so. But I've been very fortunate to be able to help a lot of people who've already had surgery. So don't give up. I mean, try chiropractic before you give up on anything like that. Okay. My office procedure, again, I just kind of review this. If you have insurance, we try to file your insurance. We try to keep you up to date. If there's any problem with your insurance, if you hear about it before we do, let us know. If you're a cash patient, I've looked at my fees with many other chiropractors in the area. I'm very moderately priced. We do have the wellness program if you want to, come for wellness, and we can talk about that in the office. But the bottom line is, I want to help you. If you're a patient of mine, I want you to ask me any question you can. Like I said, when you come in, we're going to go over things that you can do between visits, and I'll have handouts for you and all kinds of information. I have other things that I do in the practice, and I'll go over that with you. If you're not a patient and you think you may want to be, or you want more information, contact me below. I'll be happy to help you. But again, I'm Dr. Webster. My office is located here on the Roswell-Alpharetta city line. I am 1/2 mile from Webster North Fulton Hospital on Highway 9. 1/2 mile north of Webster North Fulton on Highway 9. So easy to get to, plenty of parking, and I love being a chiropractor. 36 years, 18,000 patients. I love it as much today as I did the first day I started. So if I can help you, I'm happy to. Otherwise, I hope you have a great day. Take care of yourself, and I'll see you. Bye-bye.